death can mean various things to individuals, right? So a scholar thinking about death here, look at this context. You have physicians there, and a scholar looks at death, and they're worried about that notion of the body, right? The metaphysical soul being lifted from the body. That's how they're thinking about death. But if you look at those four physicians in that picture, one of them is thinking about, right, is holding a syringe. Should I be giving medication to help someone die and not feel the pain of death, or the last moments of exasperation of not being able to breathe? The other individual is looking at the body, thinking, well, has there been a change in the physical state that I can find out whether this person is dead? There's a surgeon there. Has death occurred? Can I do transplantation of organs at this stage? Right. And the other one is, okay, charting. What is the moment of death? We declare death as physicians, right? I said time of death was X, Y, Z. The other one's, okay, is the moment of death here? So even within the domain of medicine, there are different views that people are taking, all physicians, about what's happening at death. But none of them are saying, okay, the soul has departed, right? And then what's happening with the family? The family sitting in the waiting room, in the family room, right? When the doctor will come and tell them the person's died, is worried about what happens next, right? They've just lost someone potentially that they loved and cared about. So death, even in the context of biomedicine, means various things. It has various different significations. And so this statement would hold true that perhaps it's a metaphysical, it's a biological, as well as a sociological phenomenon. And there are diverse moral significations of what happens at those registers. So another piece here is that we will all think about death, and we all come to this context of death thinking that we're all looking at the same thing and we're all talking about the same thing. But I'd argue we're not. And the moral agents in that context are these: religious scholars, physicians, obviously the patient and their family. So the reality of the bedside is what? That there are, on this left side of the slide, you see there's a purpose to death, there's a criteria by which death is adjudicated, and then there's a behavior that ensues. So for clinicians, death is a biological occurrence, right? You adjudicate it through biomedical criteria. It marks the end of some moral duties, meaning I don't have to continue to apply my trades to try to restore health when death has occurred. But there might not be a need to co-locate the two. My responsibility to the patient when they decide I don't want DNR ends in a certain way. I mean, I want to be DNR ends in a certain way, but that doesn't mean that I only stop doing things, right? I do other things for them. So we don't necessarily need to co-locate the two, that a moral duty always has to reside with a biological occurrence. For families, death marks the instantiation of some mourning rituals, right? Some, but not all. Again, it marks the end of some moral duties. And often for families, it's the onset of a clinical pronouncement by a physician, right, or a chaplain, and that's it. They don't go and say, okay, well, now I'm going to go verify this person's dead or the soul is gone. Someone said that your loved one has passed, they are now dead. That marks the change in state of how they think about their loved one. And for religious professionals, death marks the onset of pastoral and religious duties, right? Arranging for the burial, counseling the family, helping them grieve, right? Again, this onset is by a clinical pronouncement, right? I don't know if chaplains go and sort of try to do tests on bodies to make sure that someone doesn't have any biological responsiveness. Someone said they're dead, that's the end of the story. So the purpose the purpose that death serves to each one of these groups of professionals is different. The criteria by which they adjudicate it is different. And the behavior that ensues is also different. That's the reality at the bedside. So we're going to talk about end-of-life care ethics. We're moving towards this notion of death in this life, right? This transitory state. Note that these things are not as singular as we like to think about them.